Death with dignity laws authorize the medical practice of aid in dying. They give mentally competent, terminally ill adults the option to request life-ending medication that they can choose to ingest if their dying process becomes unbearable. The freedom of this patient right is choice.
On November 1st, 2014, Brittany Maynard ended her life. She would overdose on prescription medication in her bedroom, surrounded by loved ones. Earlier that year, Maynard was diagnosed with stage 4 astrocytoma and had a prognosis of 6 months. Maynard lived with her husband in California, but with this new prognosis, they moved to Oregon, where physician-assisted suicide was legal, and Maynard would be able to proceed with her choice of treatment. Her death heightened the ongoing debate surrounding the legalization of physician-assisted suicide in the United States. Physician-assisted suicide is the intentional termination of a human's life at the explicit request of the one who dies with the aid of a physician. It is legal in several countries such as the Netherlands, Belgium, and recently Canada. In the United States, the Supreme Court case Washington v. Glucksberg held that each state should determine whether physician-assisted suicide is legal. This, in turn, has sparked intense debate among lawmakers and the public. The large question underlying this controversy is, do we have the right to choose when we die? There are several theories and ethic codes that can answer this question. The Hippocratic Oath is an oath stating the obligation and proper conduct of doctors that is formally taken by those beginning medical practice. The oath is comprised of several principles to ensure medical professionals behave ethically. The current version of the Hippocratic Oath includes a key principle which reads, "But it may also be within my power to take a life. This awesome responsibility must be faced with great humbleness and awareness of my own frailty. Above all, I must not play at God." Evidently, according to the Hippocratic Oath, we do not have the right to choose when we die. Medical professionals also rely on the Declaration of Geneva. This declaration serves as another set of guidelines that uphold doctors and medical professionals to high ethical standards. Many argue that physician-assisted suicide violates the principles set forth by this declaration. I will maintain the utmost respect for human life. In providing a patient with a lethal prescription, a doctor is not respecting a human life and instead is helping end it. Just as the Hippocratic Oath, the Declaration of Geneva establishes that we do not have the right to choose when we die and instead must respect life. Though not as commonly enforced, virtue ethics are also used by medical professionals. This approach looks at the moral character of the individual carrying out the action rather than the action itself. While physician-assisted suicide will end the patient's life, that is not the only goal. Patients who resort to physician-assisted suicide often seek to end their suffering. According to the Center for Health Statistics, 91% of Oregon respondents who choose physician-assisted suicide cited loss of autonomy as their primary motive. In this context, the patient does not have ill intentions when selecting physician-assisted suicide. They simply seek relief. Therefore, virtue ethics support our right to choose when we die. While the variety of ethics and principles highlight the complexity of physician-assisted suicide, they are not the only contributing factor. Seen in Maryland's decision to reject physician-assisted suicide yet again, religion also plays a large role in this controversy. For centuries, the Christian community has disapproved of those who end their own life and therefore strongly opposed physician-assisted suicide. St. Thomas Aquinas claimed only God held the right to decide when a person will live or die. Similarly, St. Augustine argued suicide violated the sixth commandment, "Thou shalt not kill." He contended this commandment also applied to one's own life and that all life should be preserved. Seemingly, the Christian Church does not believe we have the right to choose when we die. The Death with Dignity National Center disagrees. The DDNC pushes for the legalization of physician-assisted suicide. They argue the greatest human freedom is to live and die according to our own desires and beliefs. While the DDNC does not rely on ancient ethic codes or beliefs, they simply argue that at some point the quality of an individual's life is no longer worth it. We have the right to live, so we also possess the right to die. Evidently, there are several concepts that can answer this question. The larger issue at hand is how do we choose to enforce the answer, which answer is set above the rest, and how do we decide which answer to treat as law? Will we ever be able to?